Hi, I'm Dr. John Van Wagoner. I wanted to talk to you briefly about food allergy. Food allergies are a very, very common problem nowadays, especially in North America. In my own experience over the last 15 to 20 years, we've seen almost doubling in the prevalence and incidence of food allergy. The major foods that patients become allergic to can include any of the following, and these are the most common foods, but they include milk to egg to wheat to peanut, soy, fish, and shellfish. That's the majority of what people may in fact be allergic to. Now, most people aren't allergic to anything. If you do in fact become allergic to a food, it's typically one of those 6 or 7 things that I just noted. In addition, most food allergy is developed early on in life, like the first year or 2 or 3 or 4 of life. And that would be true for patients becoming allergic to like milk or egg or wheat or soy or even peanut. Tree nuts are also in that group. Now, fish and shellfish allergy are a little less common to occur during infancy or childhood. They typically may in fact occur later on in life when you're an adult or a teen. And so, how do we make a diagnosis of food allergy? Now, typically we need 2 things. Number 1 is a history, that when the child or the patient ate that certain food, certain classic signs and symptoms occurred. The classic signs and symptoms of food allergy usually include a cutaneous manifestation like a rash. Now, the typical rash that we see with patients that have food allergy would be hives, large, itchy, red whelps that may have a central clearing and a flare around them, and they can be located anywhere on the body. Typically, it's on the face or the neck, upper chest, but they can be anywhere on the lower buttocks or on the legs or on the hands. So hives are a very common classic symptom of food allergy. Now, you may just get itchy or pruritus. Sometimes there's swelling or angioedema, and that would include like of the lips or the eye, periorbitally around the eye. Sometimes it can be around the hand. It can be sometimes of the tongue. Sometimes swelling can be of the throat. So those are other classic symptoms of food allergy. Some other symptoms would be GI upset, and that can include nausea to in fact diarrhea to abdominal cramping and acute vomiting in fact sometimes. Some of the more rare forms or signs and symptoms of food allergy would be what we call hypotension, where you kind of lose your blood pressure. Sometimes there's respiratory involvement like coughing and wheezing, bronchoconstriction, feeling tight. Those are the classic signs and symptoms that we typically see with food allergy. The second thing I usually need in order to make a firm diagnosis of a food allergy is either an objective test of allergy, and that can either be via a skin test or a blood test. Now, the skin test is a method by which we can use here in the office that gives us very quick, rapid, reliable results. And so what we can do is test you to the food of question that we're concerned about and see objectively if your body shows evidence of an allergy on the skin test. And usually within 20 minutes, a very safe, very minute amount of the allergen is placed on your skin. And if your body's allergic, you'll get a big red bump or flare or hive at the place where we poke you at. In a very safe way, we can determine whether you're allergic to that food or not with the skin test. The skin test has a very high negative predictive value, so if we get a negative to the food that we've questioned, I can usually with much confidence tell you you're not allergic to that food. Now, if you have a good history that you ate a certain food and that food gave you symptoms significant for allergy, and the skin test is also positive, then 2 and 2 typically make 4, and I can corroborate that history with that skin test, and we've kind of made the diagnosis of food allergy. If we can't skin test you, or you're unfamiliar or uncomfortable doing skin testing, then sometimes we can do a blood allergy test to determine what you're allergic to. And so with the history and the testing together, we can usually find the diagnosis of what it is that you're allergic to. How do we treat patients that have food allergy? Unfortunately, there's not a lot of options there, but one of 2 or 3 things. Number 1, strict avoidance is typically what is recommended. Now, most people that have a food allergy, they are at risk of having other types of symptoms they may not even have experienced. And so I usually take food allergy very seriously because of the risk that you could have something worse happen. And so the things I'm concerned about is laryngospasm, or your throat closing off, or you're having trouble with your breathing, or potentially you may lose your blood pressure or have hypotension. Terrible things to have as a result of a food allergy. but they are present in someone who's just had cutaneous hives after they've eaten something they were allergic to. So because of the risk of something adverse, severe, serious happening, I'm usually telling people that have an allergy to a food to avoid it strictly in their diet. And that means avoiding foods that, say, may be processed in a plant where that food is manufactured or may contain that food substance. Now, typically, most people that have a food allergy, I'm also going to tell them to have a pen of a medicine called adrenaline. Now, adrenaline is a rapid-acting hormone that's available now in a shot that can be self-administered by the patient, and that can help reverse a severe to moderate allergic reaction if you, in fact, come in contact with that food again unexpectedly or accidentally. So the hallmark of treatment for people that have food allergy is avoidance of the food. Now, here at our office at Southwest Allergy and Asthma Center, at all of our 4 offices, we also offer another alternative for people that have food allergy. And the alternative is called food allergy oral desensitization. And now what happens with this oral desensitization therapy is we are able to slowly, in a safe way, gradually over weeks of time, slowly advance the food of question that you're allergic to, some of it in my office, witnessed, and some of it at home, by small amounts of the food are reintroduced into the patient's diet until they're able to reach a very high level of the food of question, to the point where now they can eat that food without even inducing any symptomatology. It's been extremely successful. I would say about 95% of the patients that have a significant food allergy to, say, peanut, for instance, we can, over time, over about a 23 to 25 week period, get that patient now to be able to eat safely standard normal amounts of that food without it inducing any issue or complication. After we get you desensitized, so to speak, to that portion of food, you are then necessary, or at least required, to continue to eat that food in order to maintain that safe desensitized state. Now, what does this allow you to do? It allows you to now come in contact accidentally maybe to the food in question without it eliciting any signs and symptoms of food allergic reaction. In addition, it will allow you now to be able to eat that food without a problem, as long as you continue to eat that food at a minimal level over that period of time. Once you stop eating the food that we've desensitized you to, majority of the time the allergy reverts back, and now you have to be considered allergic in origin, or allergic with regards to that food. Now, this is a very brief summary of that oral desensitization therapy. It's a wonderful option that you have if you have a food allergy, and I'd welcome you to come back into our office or come to our office for the first time and let us talk to you about the very details of that therapy. It's one of the best things we can do to help people that have food allergy. So, in summary, please let us know if we can be of assistance to you if you have a child or if you yourself suffer from food allergies. It's one of the most wonderful things that we can do is help people have some freedom from food allergy, at least get you protected and educated about these foods that may be harming you. Have a great day.